To further emphasize the importance of health predictive models and disease surveillance systems, we can look at some real-world examples of their effectiveness. One notable example is the use of predictive models to identify patients at high risk of developing sepsis, a life-threatening condition caused by an infection. By using predictive models to monitor patient data in real time, healthcare providers can identify patients who are at risk of developing sepsis and intervene early to prevent the progression of the disease. Another example is the use of disease surveillance systems to track the spread of infectious diseases. In 2014, an outbreak of Ebola virus occurred in West Africa, resulting in over 28,000 cases and 11,000 deaths. Disease surveillance systems played a critical role in identifying and tracking the spread of the disease, enabling public health officials to implement control measures to prevent further spread of the virus. Health predictive models and disease surveillance systems can also be used to inform public health policy decisions. For example, predictive models can help policymakers understand the potential impact of different vaccination policies on disease incidence and mortality rates. Disease surveillance systems can also help policymakers allocate resources to areas that are most at risk for disease outbreaks, such as low-income communities or areas with a high prevalence of certain diseases. Despite the benefits of health predictive models and disease surveillance systems, there are still challenges to their widespread implementation. One challenge is the need for standardized data collection and integration across different healthcare systems and providers. Another challenge is the need for ongoing monitoring and evaluation of these tools to ensure their effectiveness and accuracy. Another important aspect of health predictive models and disease surveillance systems is their potential to improve healthcare equity. By identifying high-risk patients and communities, these tools can help healthcare providers tailor their services to meet the specific needs of these populations. This can help address health disparities and improve access to care for underserved communities. For example, health predictive models can be used to identify patients who are at high risk of developing diabetes or heart disease due to social determinants of health, such as poverty or lack of access to healthy food. Healthcare providers can then develop personalized prevention and treatment plans that are tailored to the patient's specific needs and circumstances. Similarly, disease surveillance systems can help identify disease outbreaks in underserved communities that may not have access to adequate healthcare resources. By providing early detection and control measures, these systems can help prevent further spread of the disease and improve health outcomes for these communities. However, it is important to recognize that health predictive models and disease surveillance systems are not a panacea for all healthcare challenges. These tools must be used in conjunction with other healthcare interventions and policies that address broader social determinants of health, such as poverty, education, and access to healthcare. Moreover, it is crucial to ensure that these tools are developed and implemented in a way that is culturally sensitive and responsive to the needs of diverse communities. This requires engaging diverse stakeholders, including patients, community organizations, and healthcare providers, in the development and implementation of these tools. Another important consideration when developing health predictive models and disease surveillance systems is the ethical implications of using patient data. As these tools rely on patient health information to identify patterns and predict disease outcomes, it is crucial to ensure that patient privacy and data security are maintained. To address these concerns, there are several ethical principles that should guide the development and implementation of health predictive models and disease surveillance systems.